Hello, this is Bob Tauber again. This is the third section of our video on substance abuse and 12-step recovery community programs versus harm reduction substance abuse management module. In just a little bit, I'm going to go over some of the results of using this particular training program in a SAM pilot study. But beforehand, I want to show you just some of the videos that are used as demonstration videos. Once I put the video in, it should start quickly. So let's see what we get once it goes in. Let's see if this will actually work. Hopefully it will. This program was created approximately 15 years ago, right around 2000, actually about 12 years ago. It's been used and translated into lots of languages and used all over the world. Again, it includes a basic training section, a skills training section, and last but not least, it includes a section on practice sessions. So here are the skills there are 9 skills. The first one is there's a short introduction, and then it teaches folks through demonstration how to quit after a slip, and then how to report a slip, refuse drugs offered by dealers, refuse drugs offered by friends or relatives, getting an appointment with a busy person, getting a support person, reporting symptoms, asking someone to join you in a healthy pleasure, and negotiating with a representative payee. So just to give a little more context on how this works, a group of clients, say 6, 8, 10, 12 clients, will be having a discussion about how to quit after you've had a slip. What would it be like if you were in a situation where you have been abstinent for a while and somebody pulls out a joint and you take a hit, but you want to quit quickly. You want to quit after you've made a slip. And the group will brainstorm the various ways to quit after a slip, involving what you say, what you do, how you behave. And then after they've brainstormed the various things you could do to quit after a slip, this video will be played. It's very brief, but this video will be played, and then the group will get back together and discuss what they saw in the video and if it fit what they thought they needed to do to quit after a slip. And then there'll be role play practices where the people in the group will actually practice a scenario like this where they quit after a slip, and then they'll do what's called a challenge role play, which means a much harder role play for them, using as close to possible the real people that would be involved in kind of a psychodrama. So this first skill is called quitting after a slip, and I'll be playing it right now.
Use these steps to quit after a slip. Avoid eye contact. Stand up and turn away. Walk toward the door. Say, "I gotta go," in a firm voice. Use the broken record technique. Keep moving quickly. Don't stop for anything.
Oh man, he messed it up. All that money for that, he can't make a feature. Boy, that's terrible. Well, we can't do better than that. You know what? That's what you asked for to tell me to come watch the game with you guys. Oh yeah, we're glad you could come. What you guys doing? What's it? Yeah, it's a pretty good game, you know. Come on, Shaq. Stop raising that wrist. What's that? Here you go, man. It's a joint. What's in it? This marijuana? It took 10 months. It ain't gonna hurt you. Go ahead and take your hit and wait till another 10 months if you want to. Them dudes, they just messing up left and right. Yeah, I know it's gonna be. Yeah. I'm taking another hit. No, go ahead, take another hit. What's wrong? I gotta go. Where you going, man? Huh? Where you going? You know what? I gotta go. I don't go. Well, yeah.
Okay, so that would be practiced by the group now in terms of role plays, that particular behavior as well as making it as realistic as possible. So now we'll show you just a few other ones. Let's see, we could move up to, hopefully we can move up to this next one. Oops, that might be, yes, here we go. Refusing drugs offered by a dealer.
You can be effective when refusing drugs offered by a dealer if you avoid eye contact, look straight ahead, use a hand gesture to emphasize that you mean business, stand tall and lean forward, walk past the dealer at a brisk pace, keep your hands close to your sides, use a firm voice and say, "I don't want any," over and over again.
Say, bro, you want to buy some Coke, man? It's the bomb. I'm
No, I don't want it.
Are you sure you don't
I don't
want
want
it?
it.
Man, it's good
No,
stuff, man.
no,
I'm
no.
telling you, it's
I
good
don't want it.
stuff,
I don't
man.
want
It's
it.
good stuff.
So it's that quick, but it takes 3 sessions in order to practice
Refusing drugs
that.
offered by
We'll
someone
go on
that you
here.
know well requires being direct. Make eye contact and use a firm voice. Tell the person you are not interested. Use the broken record technique. Level with the person. Tell them that you are struggling with a drug problem. Suggest an alternative. Express your feelings directly. Leave the situation if the person won't take no for an answer.
Raymond, let's go get a cigarette.
Yeah, that sounds good. So what you been up to, man?
Nothing, chilling.
Just kicking it?
Yeah.
Yeah, me too, man. Trying to pull things together, right?
Yeah, me too. You want a cigarette?
Yeah, I want a cigarette, man. Definitely. Yeah. So how's the family?
Family's alright. Doing okay.
Hey, wait, what's that, man?
Sorry.
You know, I'm in a program, man. I don't do that no more.
You don't?
No, it's giving me cravings just by seeing it, you know? Hope you don't mind. Why don't you put it away, man?
You want a hit?
No, I don't want none.
You don't want it?
I don't use it all no more. Tell you what, why don't we just go back inside and listen to some music?
Man.
No. See, Potter, you getting to cheat me off now, man. We've been friends a long time, but you know what you're doing to me right now. Tell you what, why don't you just leave this alone, man? We're going back inside.
Right,
Our
man.
friendship,
Just take a hit, man.
Nah. If you gotta do that, I gotta go, man. I'm gonna go back inside.
Raymond, you...
Come, okay, man. Look,
Raymond,
man, I'll talk to you.
wait a minute.
No, if you gotta do that, I gotta go, partner.
Just take a little hit.
No, if you gotta do that, I gotta go.
So this scenario and real world scenarios like this would be practiced. And this will be the last one.
To get an appointment with a busy person, be sure to greet the person politely, maintain eye contact and use a pleasant, firm voice. Tell them that you need their help. Say that it's important. Indicate that you only need a few minutes of their time. If they can't meet now, ask for an appointment. Get a specific time and place to meet. Restate the time and place to meet to firm up the appointment and thank the person.
Oh, Kim, I'm glad I caught you. How you doing?
Oh, I'm really busy, Michael. I have an appointment.
Okay, listen, I really need to talk to you in this awful important.
Okay, but I have an appointment and I have 20 minutes to
Okay,
get there,
well, if you
Michael.
don't have time right now, when might you have time?
Catch me after lunch today.
What time after lunch?
Be at my office at 3 o'clock.
3 o'clock at
Yes.
your office? Okay, thank you.
Bye.
Okay, so we're going to finish up this last tape with just giving you a little bit of information here on some of the outcomes of using this module, this harm reduction module. Again, we want to make it clear that for people who are substance dependent, we believe 12-step programs, and people who don't have serious, severe pathology, 12-step programs are incredibly effective and a wonderful way to go. This program was designed for people who have serious mental illness, serious mental health challenges, and at the same time are using and it's causing them a lot of harm. It's hard to read this. This will be uploaded onto Sakai for you, but I'm going to point out just some of the important things. This was a pilot study from 56 participants at the VA, out of the VA hospital in West Los Angeles. The mean number of years of alcohol use was 19.7. The mean number of years of drinking intoxication was 10 years. The mean number of years of marijuana use was 13.97, and the mean number of years of stimulant use was 8.5. Participants reported using cocaine 11 days of the previous 30 days before coming in the program, marijuana about 4 days, and alcohol about 10 days out of the previous 30, and approximately 75% had cocaine in their urine at the time of admission. So folks went through this program, which was in virtually every day or close to every day for 3 months, and then they were tested, and then there was a 3-month follow-up after that. So I'm going to be reading some of the results now. The results indicated that days of complete abstinence in the past 30 increased from 12.76 to 24.26 and remained high at the 3-month follow-up, almost 26 days of complete abstinence. Moreover, there were significant reductions in all of the main drugs of abuse, cocaine, alcohol, and marijuana. Average days using cocaine declined from 11 to about 1.4 and remained low to 1 at the 3-month follow-up. And days using alcohol went from 10 to about 2 and went actually down to 1 at the 3-month follow-up. And average days using marijuana were reduced from about 4 days to 2 days at the completion, and then went down to about 1 2/3 days. The numbers of days of taking antipsychotic medication, because again, these were folks who all had co-diagnoses of one of the psychotic disorders, was significantly higher at the completion of treatment, with a mean of 21.79 days out of 30, and at follow-up. And psychiatric symptoms at pretest on that brief psychiatric rating scale, which we went over in this class early in the class, started at a rating of 55 or so, and at post-test and at the 3-month follow-up was down to about 43. So symptoms improved as well as a result of going through this program. So we were excited about this program, but we want you to consider, I think that, Louise and I think you'll hear the term harm reduction thrown around a little bit, and I don't know that people really look at what a real harm reduction program is. So before you evaluate whether it's the way to go for your clients and whether it's something you want to embrace professionally, we just want to give you at least a look at what an actual organized harm reduction program might look like. So any last things you want to say about this, Louise?
No, just that when you're looking with clients and setting goals with them, this is often it can be your first goal towards abstinence, is deciding with a client what the goal of harm reduction is. Maybe not using for a certain amount, or not. I had one person in class say her harm reduction goal was that her client would not do crack cocaine so early in the morning. Instead, she would wait till later so that she could get her kids breakfast and off to school.
Well, that sounds really good.
It was a good goal for her, and she actually accomplished it.
That's a
she
good
could
goal.
adequately take care of her kids.
Yeah. Okay, well, thank you very much, and we'll be having some discussion forum and discussion questions based on these 3 videotape segments that you've seen. Again, thank you.